I'm going to introduce you to someone who is going to show you how he's taking things to the next level. So the gentleman is the CEO and co-founder of CarePredict. Please put your hands together and join me in welcoming Satish Movva. Come on out here and join me, Satish. All right, thanks for coming. Thanks for being here. Have a seat. How's the conference been for you so far?
It's excellent.
Yes.
And it's great to be out, no mask, talk to everyone.
Welcome to Miami.
Yes, absolutely.
Satish, you and I were talking backstage, and we were talking about obviously the moonshot and the work you're doing. But you have a very personal story that led you to focus on the area where you are. So can you just tell us a little bit about what led you to work on what you're doing at CarePredict?
Yeah, absolutely. Again, for a lot of us founders at StartUp Health, a lot of why we start these companies are due to a personal issue or a personal mission. And mine is no different. Dad's 93 this year. Mom would have been 83, but she passed last year. And they lived 10 minutes away from me, and I used to talk to them every day. But when I showed up in person on that Saturday, I would find new and interesting things that either caused me to take them to the ER that very day, or pretty much take them to specialist appointments the following week. And this unpredictability in their health was causing havoc in my life. And and I wasn't alone in this, Dan. For the very first time in human history, we have the largest cohort of humans still taking care of parents while taking care of children. And I figured with my background in technology and healthcare, over 35 years of it, I figured I could try and come at it slightly differently than others and see what I could do to get some foreshadowing of how their health truly is, so that I'm better prepared when I go visit them.
You mentioned that you had experience in technology. You've actually been a founder before CarePredict. You exited that company. You're doing a SaaS business.
That's right.
So what actually are you doing then at CarePredict? What's the solution that you're working to build?
So one of the things that I personally observed with my own parents is that there's a huge amount of human observation that goes into how we interact with others. As humans, we are wired for human observation. Whether we used to live in the trees or below the trees, we always had eyes on each other. And the first time one of us did something out of the ordinary is when we would dive in to figure out what was going on. And we see this every day. We observe our children. The minute our children do something out of the ordinary, we're finding out what's going on. Same with parents. But now, with so much of this aging being done in isolation, people are living far away, geographically dispersed. Even the caregivers that are coming in, there's a high amount of turnover, so you don't really know what the normal is for an individual to know when somebody's acting outside the normal. And so that's the way we approached this problem and said, if we can fix that, if we can get back to having something akin to human observation that we had before, but maybe through mission observation, being still privacy very centric, then we can get back to that same place where we were, where we could get a foreshadowing of what was going to happen just by looking for those alerts of some abnormal activity occurring. And that's what we've done. We've taken these activity and behavior signals and we melded them with physiological measurements like heart rate, pulse ox, and things like that. And we've created very unique digital biomarkers that are predictive of health declines. So we can predict, for example, a UTI in 3 to 4 days ahead of time, or depression 5 days ahead of time, or the probability of a fall in the next 5 days. And that's how we've approached this problem.
And this is based on activity monitoring. This isn't cameras in people's homes and looking at people and things that would make folks very uneasy.
Oh, absolutely. And especially as we age, we tend to become more zealous about our privacy to a certain extent. So definitely cameras are out. We don't do cameras. What we use is a wearable device that goes on the wrist of the dominant arm. And we invented very unique kinematic algorithms that can even tell when there's a fork being lifted to the mouth. So it knows when you're truly eating, not guessing or no self-reporting, no additional human observation. It knows when you're bathing, cooking, all of those things. And what we learned was that that is very important. That is the 99% of the individual. It's not just the heart rate and the blood pressure that people are today monitoring as part of remote patient monitoring. You need to also monitor how the individual is truly living to meld those two together to get there. And we did it in a very privacy-centric manner, a very passive device that monitors all these. And then constructs a baseline over a 14-day period, and then looks for anomalies from that to alert us. No different than if you had a human being living there 24/7 and who wondered, why did you go to the bathroom 5 times today? You usually don't do that. That's the earliest sign of a UTI. And so we are doing that level of observation, if you will.
And this is health at home. We've all been spending a lot more time at home over the past 2 years. You began to commercialize this in 2017, I understand. So we've seen a lot of change between 2017 and 2022. What are some of the big obstacles that you have to try to get over, and who's actually making the buying decision to bring this in?
Yeah, so our initial market has been senior group living facilities, independent living, assisted living, and Alzheimer dementia care centers. We're in about 80 facilities throughout the country and have about 8,000 subscribers today, residents. And that has just started snowballing post-COVID. If you look back at COVID, a lot of the unnecessary fatalities that were happening were in senior group living and nursing homes. So they've got this idea, this technology is no longer a nice to have, it's a must have if we're going to keep our seniors safe. Because as part of our product, it's a multifunctional product. It also is the only automated digital contact tracing solution for senior living facilities on the planet. So they started using that to track, infection vectors and stuff. So that market is where we started, and it's growing tremendously. But when we look at, the whole addressable market, you got about 2 million people living in senior living, and you got about 18 million living at home with some kind of paid caregiver. And then you have another 36 million living at home with some kind of family caregiver. So the greater market is at aging in place. So we made a conscious decision late last year that we're going to get into this aging in place segment. And our approach into that has been through home care agencies, folks like some of the biggest home care, private pay, private duty home care agencies in the country use our product with their clients. So we still have a channel to sell it through. But the underlying beneficiary of everything we are doing, Dan, is the Medicare and Medicare Advantage. So we made a conscious decision last year that we are going to go more into the care management side and get into the more of the risk models and things like that, but also get into the special needs plans so that we can get into the institutional special needs plans as well as the dual eligible special needs plans. Because those are the high complexity folks. They have 2+ ADL deficits, 3+ chronic conditions. They are the ones who are going to benefit the most. And when we talk to payers, what we learned, Dan, is that aging is a black box in between medical encounters. No MA plan knows when a member is going to show up at the ER. They are monitoring through remote patient monitoring things like heart rate, blood pressure, and all that. But that's only a fragment of an individual. You need all the rest of it. So one of the things we learned when we spoke to MA plans is, the person is not necessarily showing up at the ER because they had an exacerbation of their hypertension. Yes, it happens, but not so much. What they're showing up there for is nobody knew that they hadn't eaten in a day and a half. They had a hypoglycemic reaction, fell and broke their hip, and that's why they're at the ER. That RPM did nothing to tell you about that process. So that's where we're coming in. And we think it's going to completely be a paradigm shift in how aging in place works. Because for the first time, we're instrumenting seniors and collecting telemetry from seniors to know when something is going wrong so we can help them earlier.
So AI certainly has a place in that, but where do the people come in? Because I'm part of the sandwich generation, right? I have young children I'm raising and older parents, aging parents who are beginning to get concerned about as they continue to age. So I can see where this is something that I would like to introduce to them. But who has access to this? Is this something that adult children and carers like yourself, who are developing this for your father and your mother, that you can have access to this as well as the doctors and facilities?
Yeah, absolutely. I mean, we want to have the data democratized throughout the continuum. So today within senior living, it's the care staff that has all that data, and they're actually acting upon it. So they're verifying the symptoms and they're triggering the clinical intervention through an external healthcare provider. But that same data, curated to a certain extent, is also available for the families of the resident in senior living. So they are also getting to see that data. For the first time, they're having visibility. And interestingly, prior to COVID, no senior living facility wanted to share data with the family. Post-COVID, everybody wants to share data and be transparent, so that really helped. And within home care agencies, it's the home care agency that's responding to the alerts and triggering the intervention through the primary care physician. And then, direct to consumer absolutely is going to be the care circle. And care circle is the family member, the neighbor, the friends. They all can get alerts, and the senior gets to choose who gets what kind of alerts. Maybe daughter gets the alerts that include bathroom visit duration and frequency, but maybe the neighbor doesn't. So you have that level of granularity. So we built all of that for those stakeholders, and now we built out a population summary dashboard for all the care management folks, the case managers at MA plans and so on. So they can consume the data, they can trigger a nurse intervention or a physician intervention directly.
What's the big thing that you would like for people to know about health at home? This is a relatively new area. This is something that's going to continue to grow.
Right.
And frankly, not just here in the US, this is happening all around the globe.
Yeah.
So what are some of the key things that you would like people to know as they're looking at this sort of solution and this industry?
I think the one thing people are underestimating with the whole aging in place is you need constant access to data about how an individual is doing all the time. You cannot have those point-in-time encounters with a human that comes in, looks at them for 30 minutes and leaves, or comes in to provide, an hour worth of the grooming service or whatever it is and leaves. That is not sufficient. You need a lot more information about how an individual is truly aging. That means, are they eating properly? Are they being as active as they should? Are they having, abnormalities in their activities and behaviors that are not apparent during those intermittent human visits? If you don't have that data, aging in place is going to continue to be a black box, and you will continue to be surprised by the events that happen. And the only way to get there is you need some sort of telemetry, and you need some sort of observation of that individual. And one thing I'll say, and this is again personal experience with my own 93-year-old dad and 83-year-old mom, the more we are aged, the more aspirational we become. Mom would tell with a straight face to her physician while I'm in the room, oh yeah, I'm being active, I'm doing this, that, and the other thing, and me and my dad are rolling our eyes behind her because we know she didn't do any of that. Right. So it's, and it's not, they are in denial about their own frailty, so sometimes we need to be able to hold up the mirror and say, this is where you are. And there's a positive aspect to that. As we are aging, there aren't enough cues to tell us how we are aging and where the slope of decline is. Having this kind of information that says, hey mom, you used to cook 5 times a week and now you're down to cooking 1 time a week. That kind of thing helps them understand their own decline. And understand that they can get re-engaged and re-empowered in their own care and in their own aging process.
So in early 2020, the world announced that we have a new Chief Transformation Officer for the world. It's called COVID-19. It drove just transformation across every part of the world, from energy and manufacturing to entertainment and health, obviously.
Yeah.
So it affected a lot of industries negatively, and in some areas it really helped to drive necessary change that frankly many of us have been talking about for a long time and have never had a chance to get out on the field and play the role that we know we were capable of doing. How has this affected your business? What have your results been coming through this pandemic?
Yeah, I mean, we were pretty badly affected because at the time it started, we were only in senior group living facilities. And as you know, those got hammered. And while they were getting hammered and they were busy fighting the fire, obviously they're not buying anything or doing anything. So that really hurt us as a company in 2020. But towards the end of 2020, something happened where they suddenly realized, look, we need these kind of things, this kind of data, to reassure the families that we're taking care of their loved ones properly. And so they started seeing this as an essential part of the service that they need to have.
Yeah.
The other thing that helped is, because as part of our solution, we have very precise real-time location tracking within the senior living facility. We track the visitor, the staff, and the resident in real time within seconds. We were able to very quickly build out a contact tracing solution into our product and disperse it within 2 weeks to all of our customers. And we did a modeling, peer-reviewed, published modeling study as well on how automated digital contact tracing worked based on the data we collected, and we posited that you could isolate about 60% fewer people. But in actual practice, our customers are finding that they are isolating about 86% fewer people by having automated digital contact tracings. It's so precise. It's exactly telling you this is a cluster of 5 people that need to be isolated. Don't lock down the whole facility, because you saw what happened when entire facilities were locked down. People were isolated. They were being given food through the door as though it was a prison. And more people died of isolation and its ill effects than directly from COVID. So that really transformed. And now we are on this glide path where people realize this is something you need. And along came home care with their caregiver issues and people staying more at home and not going to senior living facilities. It brought this entire aging in place trend to a peak. And we are right there to say this is the data you need if you want somebody to safely age in place independently and economically.
So I want you to get out your crystal ball here. Last question for you.
Yeah.
Look into the future, 20-year horizon. What is the impact of this solution, your company, this industry on people's lives? What will the impact be?
I think I'll go back to that earlier theme. It's instrumentation and it's telemetry, right? Without data, we cannot act. And you have to collect data. Seniors are not going to use smartphones beyond a certain age. They have visual acuity, manual dexterity issues. You need a data collector, whether it's a wearable today or something else tomorrow. You need data to be collected. You need it to be constant. You need it to be actionable. And that, I think, is going to become a fact of life. We're all doing it involuntarily, unconsciously. When we all wear our Apple Watches, there's data being collected. There's telemetry being collected. Seniors just need a different kind of a device and different types of data to be collected all the time. It's going to be no different than a Progressive Insurance putting that little dongle in your car and giving you a break on your insurance because they know your driving habits. Eventually, I believe that healthcare insurance would be predicated on how well you're engaged in your own health and what are you doing to take care of yourself.
Brilliant. I can't wait to see all that happen. It's great to be a part of the change and see what you're doing there. Let's just all put our hands together for Satish at CarePredict.